Lambton, Kent, Middlesex.
Well, thank you very much, Mr. Speaker, and I'm very pleased to rise today and speak in support of the Compassionate Care Act, Bill 182. First of all, I want to applaud the member for Niagara West Glanbrook for bringing forward such an important and thoughtful piece of legislation here today. This bill addresses a serious problem in our healthcare system. Over the last decade or so, Mr. Speaker, the government has been quite frankly, a poor steward of our palliative care system in this province. The Compassionate Care Act would be an important step towards getting Ontario back on track so patients can get the care they need and deserve. I also want to thank, and I know the member from Niagara West Glanbrook mentioned her as well in his opening remarks, but I want to thank the MP from my neighbouring riding of Sarnia-Lambton, Marilyn Gladue, who led the charge on this at the federal level with Bill C-277. She shepherded her bill, which provides for the development of a framework on palliative care across Canada, through to royal assent after receiving unanimous support in both the House of Commons and the Senate. I hope to see this bill enjoy similar bipartisan support here today. MP Gladue was clear about why this is such a vital initiative, and I quote, "Canadians, when given the option, will choose to live as well as they can for as long as they can. Providing better palliative care service across Canada will strengthen our nation and improve conditions for millions of Canadians making important healthcare choices." Mr. Speaker, palliative care is extremely beneficial for patients, their families, and for the healthcare system as a whole. The support and expertise of specialized palliative healthcare providers ensures optimal care and comfort. Currently, too many acute care beds and alternate level of care bed days are being occupied by patients with a palliative care diagnosis. The most recent statistic I saw was that 2/3 of Canadians die in hospital. That's not what patients or families want, and it's not an efficient way to run our healthcare system. I also want to mention that the need for action on palliative care is even more urgent now that assisted suicide has been legalized. No one should ever feel pressured or in any way compelled to pursue assisted suicide because of concerns about lack of pain management or other end-of-life care or concerns about being a burden to family and friends. As legislators, we need to be working to ensure no one is put in that terrible position. This government owes it to the people of Ontario to improve access to and education about hospice palliative care. I wholeheartedly support this bill, and I hope the government will do the right thing and allow this bill to move forward, get it through committee, and get it back for third reading before the election. Thank you, Mr. Speaker.
Thank you.